Hello everyone. Thank you so much for stopping by to my channel. Thank you so much for watching my presentation on geriatric trauma. This project was conducted to design, implement, and evaluate strategies to identify and manage geriatric trauma. Before we get started with this presentation, I just want to go over the learning objectives with you guys. First objective of this project is to analyze current and relevant literature on strategies to identify and manage geriatric trauma. Second, implement an in-service program in the emergency department and collect data on the effectiveness of that training. Third, to evaluate the effect of the in-service training program on identifying and managing geriatric trauma within the emergency department. I hope you guys enjoyed this presentation, and thank you guys for watching. All right, let's get started. Before we continue, I just want to make sure that we all understand the term geriatrics. So a quick question to you guys. Who is considered a geriatric? Who is a part of the geriatric population? Well, an individual who belongs within the age group of 65 and over is considered a part of the geriatric population. Baby boomers are individuals who were born between 1946 and 1964. The life expectancy of the US population is 77, and baby boomers continue to surpass the life expectancy of the US population. With the rapid increase of the geriatric population causes a strain on the healthcare system as more resources has been used to fulfill the need of the growing geriatric population. Many of you can attest that growing old is a wonderful thing, yet scary. Aging is the body's way of growing old. And as we grow old, there are changes in the body's structure. These changes causes geriatric population to become more prone to trauma or injury than young adults. The geriatric population are more prone for hemorrhaging. They have frailed bone due to osteoporosis. And of course, hemorrhaging is caused by medication that they are on due to long-term or chronic conditions such as AFib. Injuries that may be simple for young adults or adolescents may be detrimental for the geriatric population due to their frailness. It is very important to understand the physical or physiological change within the geriatric population in order to treat geriatrics. Specific treatments are hard to select due to advanced age, non-compliance with care, neurological issues, medication regimen for chronic conditions, and changes in the body's physiological structure. Advanced age is related to the frailness of the bone, the thinness of the skin, and non-compliance with care. Older adults are more likely to delay treatment. They rather spend 2 days at home or wait for their primary care provider before coming into the emergency room. Geriatric Practice Management Guidelines. This was based off the Geriatric Practice Management Guideline, Eastern Association for the Geriatric Surgery of Trauma. For the management of geriatric trauma, it is imperative that we have a proper triage at hand. For geriatric trauma, triage can be a little different from younger adults. A lower in threshold for trauma activation should be utilized for injured patients greater than or equal to 70 years old who are being evaluated at a trauma center. All elderlies who receive their daily therapeutic anticoagulants should have appropriate assessment for their coagulation profile as soon as possible after admission or during the ED. There were no specific guidelines for geriatric trauma within the state of Virginia. None was disclosed online. However, from the Geriatric Trauma Practice Management Guideline, Eastern Association for the Surgery of Trauma, information from this was used as a guidance for the management of geriatric trauma within this project. Healthcare professionals are responsible for reporting suspected elderly abuse, neglect, or exploitation. It is mandatory for healthcare workers to report any form of abuse among the elderly population. Abuse presents its way in different forms. There's physical abuse, emotional abuse, financial abuse. What are the signs of abuse? Signs of abuse presents itself in when patients stop taking their meds, when patients or elderly start to look messy, unwashed hair, unwashed clothing. Elderly tend to have trouble sleeping, losing weight for no reason, display signs of trauma by rocking back and forth, has unexplained bruises on integumentary, having bed sores even though they can be prevented. There are numerous signs of abuse. In the event that an abuse is suspected, it is required for the healthcare professional to report the abuse to the local Department of Social Services or call the Adult Abuse Hotline. Failure to make the required report can result in a fine of up to $500 for the first failure and not less than $100 or more than $1,000 for subsequent failures. An employer of a mandated reporter shall not prohibit a mandated reporter from reporting directly to the local department or the Adult Protective Services. This project was conducted at my job with the help of a mentor. I work in a hospital setting. I work in the emergency department. The hospital that I work is a general and surgical facility. It is not a trauma facility. However, we can't control whoever walks through the door may or may not be a trauma patient. We will not turn away the patient, but we will provide the best care possible while setting up transportation for the patient to receive the optimal care necessary for their injury. Even though I don't work in a trauma facility, geriatric trauma still presents itself within the ED on a regular basis. I conducted an in-service on strategies for identifying and managing geriatric trauma within the emergency department. At the end of the in-service, employees were asked to sign a in-service training sign-off sheet. This will act as a accountability for those who attend the in-service. I developed the 4-point geriatric trauma as a great tool to identify geriatric trauma that presents itself within the emergency department. Each criteria is worth 1 point. A maximum of 4 points can be recorded. Greater than 3 or equal to 3 is considered a trauma. The following criteria are listed as follows: injury to one or more limb or extremity, loss of consciousness or head injury, hemorrhage or uncontrolled bleeding, and persons or patients who are on anticoagulant medication. These criteria poses significant risk to the elderly population. The 4-point geriatric criteria can be assessed during the initial stage of the triage process. In the event that the patient is greater than or equal to 3 points, the nurse is required to report the incident to the provider immediately. This will prompt the initiation of special treatment or transferal to a trauma center where the patient can receive the optimal care necessary to promote a positive outcome or reduces any complication related to the injury. After conducting the in-service, staff that attended the in-service was evaluated at the end of 1 week for compliance for the 4-point trauma criteria. The tracking sheet consists of 2 questions. First question was to identify if they were compliant with the training, and in the event that they were non-compliant, staff was asked the reason for non-compliance to the training received. 100% of staff who attended the in-service was compliant with the 4-point trauma criteria. Based on the result obtained, one can attest that the criteria or strategies identified was effective in identifying and managing geriatric trauma in the emergency department. In the emergency department, the nurse's main priority upon arrival of a trauma patient is to complete an accurate documentation of the event that led up to the visit. The geriatric population frequently use the emergency department than any other age group. Therefore, the use of the 4-point trauma criteria will help nurses evaluate geriatric population for trauma at an efficient pace. Thank you guys for listening to my presentation. This concludes my presentation. All objectives were met. The strategy to identify and manage geriatric trauma was the 4-point trauma criteria that was created by me. My facility currently does not have a policy for the geriatric population. Hopefully in the near future, we can have the 4-point trauma criteria formally a part of the triage process and also a part of the geriatric population policy at my facility. A list of all the reference used for this project can be located within the reference section. Thank you guys for watching my video.